So now I'll show massage techniques for the back of the thigh. Because we're going to be using an oil, I would tend to, because this patient has shorts on, we'd probably prefer not to have oil on them, is I would let the patient know that I'm going to tuck a towel around there as well. So there we have that. We'll get a little bit of massage product. As is typical, we'll start off with some effleurage, working up the leg. Now, one of the things that's important to keep in mind when you are doing massage on patients is when you set up a physical boundary, in this case a towel, keep to the boundary. So your hands are not going to slip underneath the boundary, and then that way the patient knows what to expect. If by chance, I know with bra straps and whatnot, we have done some things where we've moved the bra strap out of the way to get onto the back, but we want to let the patient know when we're going to do that. Similarly here, so this is the boundary where my fingers are not going to make their way under. If I feel the need to get to, let's say, the ischial tuberosity, which we'll talk about in a minute, then I'll talk to my patient about that so that they know where my hands are going to be and where my hands are not going to be. So some effleurage to start off with. Using the hands. Different techniques. You can do one hand over the other, or you can do both hands beside each other, or you can do alternating. There's just many, many opportunities to make that a little bit different depending on what works for you. To make that, to change your tool or modify it, you can use a loose fist. And again, this is just a nice moderate pressure effleurage, making my way up the back of the thigh. Really important to try to include the adductors, but again, respecting that boundary. When your hand hits the towel, you make your return stroke back down. And now I'm on the lateral part of the thigh, vastus lateralis, and the IT band. And that's all effleurage type strokes. Alternately, we can do effleurage with the forearm, which is a really nice broad tool to use. I can rotate the leg a little bit. Actually, I'll change tools so my elbow can be on the inner thigh instead of my hand. And alternately, I can rotate the leg the other way. Nice broad strokes with that form of effleurage. Next, we'll do some palm kneading. Palm kneading on the thigh is a little tricky because obviously once you get up a little higher on the inner thigh, your hands and fingers are getting into personal space. So an alternate way to work with that is obviously as you get up there, is you can just kind of change the tool, make sure you respect the boundary, but include the adductor muscles just the same. So that's probably high enough for my inside hand and just a little scoop around. Alright, open C's is next. This is a really great stroke for inner thigh. So again, picking up and letting the tissue go using our sort of our puppet hand or our open mouth, open C type of movement. I'm doing open C's really posteriorly here now. And a little harder to see, but I'll get a bit lower and we'll do open C's on the lateral thigh as well. On the thigh, it's really nice to do a little bit of a picking up, which is a bigger sort of picking up move, where we're going to use the flats of the hand and basically do a scooping motion. And again, really nice and inclusive because you can get around the whole anterior, or pardon me, the medial and lateral aspects of the thigh. And another way to do it is with loose fists. And again, this table height's not all that great, so I'll see if I can lunge into this a little bit more. And just respecting that boundary there. Compressions can also be done. So again, with our compression movements, there's really no circular component. You'll notice my hand, my fingers are facing down as I get up to the pelvis, just again so that I'm not getting my hand on that inner thigh area too personal or too close there. I'm doing some compressions down. You can also do compressions with your fist. Pressure okay on that, Abby? Okay. Good. And similarly, what we talked about on our first day of the course, is I'm not compressing in the popliteal space, I'm just adjacent to it or proximal to it. And on either side you can certainly put lots of pressure in because that's where the muscle tendons are located. You can do some fingertip kneading. Sometimes on hamstrings it's a little bit ticklish. Similarly on the back, just like on the hamstrings, we've got a fairly broad base of muscles that we're working with. So you might choose to do a line more medially, more posteriorly, and then a line of fingertip kneading more laterally. And there's no reason why you couldn't use a loose fist to do that kneading, etc., etc. So all those tools are very applicable on the thigh. Thigh's a nice spot to do some ringing. If you wanted to include stretching for the quadriceps muscles, you could certainly do that in this position as well too, actively or passively, or add some PNF to that. So that's an option that can occur there. And then certainly you could end off your session with some tapotement. And I'll just cover for that, Abby. So again, some clapping, some hacking, some pounding. I think my patient's just about done with that. So we'll just end off with some compressions to make friends again here and a bit of jostling on the muscle. That's the posterior thigh massage techniques.